Michael Zazzaro from Land O'Lakes, Florida, worked in the medical industry for decades, sacrificing his own physical health in service of others.
I've been first responder for the first 10 years of my career, firefighter, paramedic, which entailed a lot of lifting and twisting. But then they didn't have hydraulics like they have today. So you had to actually manually lift stretchers with people on them and turn into a truck. And this is difficult enough, but then you add to that the frequency, and then sometimes doing 2 or 3 jobs with the same kind of movement is detrimental to your health.
In 2011, after many years in acute pain, he sought help in the form of fusion surgery.
I had been an RN for about 26 years and doing 12-hour shifts on my feet in the emergency room. And it was just grueling work. It was constant movement. And just the weight of my own body was deteriorating my discs as I have the disease to start with. So it got to be to the point where I couldn't walk anymore. I had open surgery done. The doctor did a great job. Even the doctors today that have worked on me since said your initial surgeon did everything he could for you. That's not always good enough because there's only a certain amount you can do through open surgery to reduce recovery time and to increase the efficacy of the procedure. So you're limited by what it is. From day one, I had these low-grade temperatures. Turned out that I did have a little bit of an infection in the bottom part of the bone of the spine. It's called osteomyelitis. So I had to be on an antibiotic, exorbitant amounts of antibiotics, to a PICC line in my arm. And I had to give them to myself at home. My wife's a nurse, so that was helpful. So nobody had to come out, but still it's 2 grams and 2 grams twice a day, and you get thrush, the whole mess.
Though he eventually recovered from his fusion surgery, Michael knew it would not be the final answer to his lumbar problems. And after remaining in pain for a few years, he decided to reach out to the Bonati Spine Institute for help.
I used to work at Springfield Fire Department and drive from Dunedin. So on the drive back and forth, I would always see this Bonati Institute, and I never knew what it was. And then years went by, taking patients to Bayonet Point as a firefighter. And years go by, and my wife is working across the street in the trauma center. So finally, I said, you know what? It's time to get somebody that I can trust that's not gonna run a mill and just try and crank people out of there. And you put Band-Aids on the problem instead of fixing it. So I'm gonna go with the guy that's always been there. He seems to have pioneered most of the tools and the way to use them. I'll tell you what, I walked in the door, I was greeted by Paul, Anne-Marie at the desk. I remember everybody's name there. Eric was the nurse at the time. Dr. Scott immediately and Dr. Bonati both met me the first day. This is a place to get personal care. You feel as if you're the only patient in the entire institute.
Once Michael met with the surgeons and staff reviewing his case in detail by discussing his symptoms and thoroughly examining diagnostic imagery, he began his surgical summary. Bonati surgical guests actively participate in their surgeries through the use of conscious IV sedation.
But you're totally cognizant of things they want you to feel. Like, where does this hurt? Lower leg, outside. And they then can pinpoint the exact nerve that you were having pain from. I've had more painful teeth cleaning, truthfully. The recovery time was minimum. And like I said, the whole experience is almost surreal. You go in, these same people I've seen before, maybe the 3rd time I've been there. First time was to remove hardware, 2nd time was to remove the rest of the hardware, the 3rd time was to do some work on the bones. You take it in stages, and if something helps, you stop and just wait, see how you recover, instead of going in there and trying to fix everything at once.
Once the procedure is completed, after a short time spent in the recovery area, guests leave the Institute to relax and recuperate in the comfort of their hotel room or their homes. With a patient-reported satisfaction rating of 98.75%, Bonati guests can feel results immediately.
You know, the great thing for me, as far as immediate gratification, well, the very next day, I could put weight on my foot and not have that pain shooting down my leg. And that's what it's all about, because you are only as good as that weakest link. The first thing to put you off your feet, it's a game changer. And it's a game changer from an emotional standpoint because of the chronic pain, what it does to you psychiatrically, what it does to your self-esteem. You have to pull yourself up, and Bonati gives you a chance to do that now with instant results. automatically you're thinking, I'm getting better, and that gives you that lift. Now I have some ongoing issues on the right side that I knew of, but we're waiting for scar tissue and things to fill in. But each step is a stepping stone toward less morbidity and more joy. So each step is another, oh, there's something else that I can do now.
Having a career as a healthcare professional, experiencing both an invasive open back fusion surgery and the targeted Bonati spine procedures, Michael knows the best outcomes happen when you take part in your own care.
If I had run into somebody in the street, for instance, and they were telling me about their back pain, and being that I have a relatively decent understanding of how the back works, having been through it myself, I would I think my best advice to this person would be, number one, get more than one opinion and let one of them be a laser spine surgeon. Now, my experience has been with Dr. Bonati that you're gonna get upfront what your expectations are. This is good. This is to the point, it's succinct, and it's accurate. And they've got it down to literally a science. And they're willing to show you exactly what's wrong and what your expectations can be. You can derive from that. And they'll give you percentages, like 80% of the people do this, to this, to this. So you're never making a non-informed decision. Dr. Bonati has a unique way of approaching things when it comes to spinal surgery. There's a lot of spinal surgery places out there, but I've worked at them before. So I'm telling you from experience, this is the real deal. This isn't the Band-Aid, this is the fix.